It's Head and Neck Awareness Month, and UI Health is raising awareness with free screenings throughout the month of April.
Head and neck cancers account for nearly 4% of all the cancers in the U.S. Dr. Chen Lin joins us with more on the risk factors and what exactly we should be looking for. So as Sarah just said, we had no idea there was even a Head and Neck Awareness Month. So this must be a good place for you to start showing awareness and hey, this is a real issue. Can you talk more about just what are head and neck cancers specifically?
Yeah, great question. So head and neck cancers really includes all cancers from the neck and the head region. The couple areas that we don't cover are the brain and the spine, but most head and neck cancers involve cancer inside the mouth, the throat, the voice box, and also cancers of the nose and sinuses are the majority. But in addition to that, some of the other cancers that you don't hear about too often that we cover include salivary glands like parotid and submandibular glands that make our saliva for our mouth, as well as like thyroid cancers and even skin cancers, typically larger ones.
So if you are somebody who's concerned about this, as I think everybody would be a little concerned anytime you hear cancer, what are the indicators of any types of these cancers?
Absolutely. So some of the most common symptoms you're going to find are inside the mouth. So actually seeing some kind of ulcer that's not going away, a mass or feeling like something growing in the mouth. Pain is one of the most common symptoms associated with cancers in the mouth, the throat, voice box. And then a neck mass also. A neck mass would usually indicate if this was cancer, potentially spread of cancer into the lymph nodes. But some of the other symptoms that we'll commonly hear are changes with swallowing, difficulty swallowing, weight loss, changes in your voice, and even in extreme cases, breathing issues. But these are usually symptoms that evolve over many weeks, even a few months.
So what about the risk? Like if somebody's at home watching now and go, geez, how do I know if I'm at risk for head or neck cancer? What would you say?
Yeah, so the most common ones classically are tobacco use, cigarette smoking, a long history of that, as well as heavy alcohol usage. And then nowadays, over the last 20 years or so, we've had a lot more awareness and understanding that there's a rising number of cases due to HPV, human papillomavirus.
Really?
Exactly. So these specific type of virus-induced cancers will usually affect what's called the oropharynx, or throat commonly. So that's going to be the tonsils and also the very back of the tongue, which is usually an area that you can't see just looking through the mouth.
Interesting.
And then how would it be diagnosed? Once you think you have a problem, you come see the doctors at UI Health. How is it actually diagnosed at that point?
Yes, so a biopsy is the way to ultimately diagnose these cancers. And so that's something that we can typically do in the office. A small little piece is taken to ultimately have that reviewed by a pathologist to have it diagnosed. But as part of that exam, we obviously do a full head and neck exam. We're taking a look in the mouth. We also have special equipment that actually allows us to look at the back of the throat and into the voice box, the larynx. And all of these together will help bring us to a diagnosis.
And let's say, you know, in particular for this event that you have coming up, let's say somebody, you know, you do an exam and you find somebody has something that seems problematic. How would you treat it?
Yeah, so head and neck cancer is typically treated with a combination of surgery, radiation, and chemotherapy, or newer age drugs, immunotherapy. So classically, the treatments are either surgery up front or radiation and chemotherapy up front. Here at UI Health, as well as many academic centers, we have a very large multidisciplinary team that involves the oncologic surgeons, the reconstructive surgeons, as well as many other important doctors, including the radiation oncologists, medical oncologists, and additional treatment members to help focus on the quality of life for these patients too.
If anyone's concerned, they can come see you. Very easy, free screening coming up in April.
Exactly. So we'll be happy to see anybody.
And you said it's quick. It's not. It doesn't take long.
No, it'll be done in probably 1 minute, a quick view through the mouth.
Beautiful. Well, Dr. Chen, thank you so much. We appreciate it. For more information, scan that QR code right there on your screen, or you can head to ent.uihealth.care. You can also find them on Facebook and Instagram for more information.
Good information. All right. Thanks.